Welcome back to Living Local. Today we are unpacking women's health, specifically an issue that affects at least 24% of U.S. women. Pelvic floor disorders can cause physical discomfort and can limit activity. Now, research shows that the frequency of pelvic floor disorders increases with age, affecting more than 40% of women from 60 to 79 years of age and about 50% of women 80 and older. And the good news, though, is these disorders can often be treated easily and effectively with natural methods. Joining me in studio is physical therapist with Back to Action, Barb Park. Thank you so much for being here, Barb.
Yes, thanks for having me.
Yes, we're having you back again. Before you were on the show, now you're back. We're talking about the pelvic floor. So what is that?
The pelvic floor in women and in men is like a hammock. So I have this beautiful model here that comes apart. But the pelvic floor literally holds, these are the female inners, and it is a hammock like you would have in your backyard. So you can see it's just slung there to hold our inners.
And Barb, a lot of times, and I love the analogy with the hammock, I've actually never heard that before, so I think that gives us a great idea of how this works. And what can happen with some women, a lot of women, is that either it's too tight or more often it gets too loose and it can cause issues. So how common are pelvic floor disorders among women?
Actually, the numbers are very high, but those are the women that actually report it. So the pelvic floor, we all live with gravity, and many women have babies. So that pelvic floor gets completely stretched out, and it has to come back together. And when it is weak, it doesn't pinch off the hose and prevent dribbling or leaking, or coughing and sneezing, which you can you sneeze at 200 miles an hour, so it's kind of hard to pinch off the hose if it's stretched out. So by comparing it to a hammock, what I do is, if you had a hammock in your backyard and you had a significant other, we'll call him Larry.
Okay, Larry, all right.
Lazy Larry is in the hammock. Lying in the hammock.
Love it.
And it's lying low to the ground. So you're gonna go out and you're gonna say, Larry, I want you off the ground. And would you try to cinch it up with him in it?
Nope. Give him the boot.
So what we're going to do is we're going to say, Larry, you need to get out of the hammock so that we can cinch it up. And the other thing you would do, he'd get out, and you wouldn't go straight to the hammock and try to cinch up the hammock itself. You go to where it's connected, okay? And the connections is where we want to strengthen the muscles. Kegels, which most people have heard about, is going straight to the hammock and trying to cinch that up, okay? Research shows, biofeedback shows, 80 to 90% of women don't do the Kegels correctly. So we have this muscle here inside the pelvis, the obturator internus, that literally cinches up that hammock.
How do we strengthen those muscles then? Because you say, you know, the Kegels, number one, they're not usually being done effectively. And then number two, they're actually not going to the root of the problem. It's kind of like a Band-Aid almost. So how can we strengthen those muscles where they need to be strengthened?
Well, I got simple exercises.
Great, I like simple.
So what I do is I have women get a clinical wedge, and we have these at our clinic available in stock. And literally, they lie on the wedge, their knees would come up over this way, and you can envision how the hammock would be unloaded, all right? And because of the cincher muscle that lines the pelvis, it comes out, attaches to the hip, we've unloaded the hammock, and now we're going to do just a little external rotation of the hip, okay, against a TheraBand, which most people know about in physical therapy. And it's just an amazing, it works. It works very quickly. People notice a difference within a week.
Now, how often should women be doing these exercises?
If you're having issues, every day, okay? Research has shown that you can have a descent of an organ, like a cystocele. And they took women with grade 3 cystoceles, which is surgical, it's falling down between their legs. If they would lie on a wedge 10 minutes a day for 6 weeks, every day, for 6 weeks, then it reversed to a grade 1, non-surgery.
And that's a great point, because a lot of times when women have these problems, they may think that surgery, invasive procedures are their only options, maybe even pharmaceuticals. What are the advantages of doing physical therapy in all natural method?
Well, you don't have side effects of drugs, and whenever you have a surgery, there's a potential of failure. I just had a patient in the other day that her sling worked fabulously for about 4 or 5 years, and now it's failed. So now she's not going to have another surgery, but she has this option, and it works.
Barb, what are the outcomes that you have seen with patients that go through this treatment plan with you?
It only takes a couple treatments. It's mainly educational. You keep your clothes on, because I have these models, and we go through the exercises, and literally people are better within, they come back their second visit and they're like, I can already tell a difference. And I've had people with pelvic pain also, which is the opposite of too loose of a pelvic floor. So everything is tight down here and we need to relax it. And I do an obturator internus release, which is not going in any holes. It's just releasing a tight muscle just in the private area. And it literally has taken away people's hip pain, able to sit. They were too uncomfortable to sit. I had a gal years ago that Miranda had for 2 years suffered from hip pain, been to all kinds of doctors, and couldn't exercise, put on weight, you know, was living in pain. They were thinking about doing a labral repair surgery. I did the obturator internus release, 80% better, did a second time, 100% better, ran into her 6 months later, didn't recognize her. She had lost 40 pounds. She got back to exercising. She's like, I don't have pain. I didn't, you know, she's just two visits. So that's what's amazing about this. It's natural, it's simple, it's non-invasive, results right away.
And those results are absolutely incredible, Barb. And as a side note, great information. A side note to this, I was on the phone with you a couple days ago, and we have some exciting news. So Back to Action actually just got the Better Business Bureau Business of the Year. So congratulations about that, Barb. What does that mean to you guys?
Well, it's actually Absolute Balance Chiropractic.
Absolute Balance Chiropractic.
That got the Better Business Business of the Year, the Torch Award, and Absolute Balance is a big umbrella. Dr. Kay Knight is the owner and operator, and we have all female providers. So we also have Dr. Amy Blevins. We have Back to Action Physical Therapy. We have Total Image, where we do medi-pedis. We also have Forever Me, which is downstairs, cancer specialty boutique. And we have Michelle, who is a phenomenal massage therapist, and she also does lymphedema therapy.
Barb, an incredible resource for women's health here in the Quad Cities. Thank you so much for being here today.
Thank you.
Appreciate it. All right, for more information on physical therapy, give Back to Action a call at 563-332-6596, or you can go to its website at bettendorfpt.com. We will have all of these details posted on ourquadcities.com. Stay with us. More Living Local is up after this.